It's not a novel concept to cease outside activities close to dusk in order to shield people from a fatal infection spread by mosquitoes. The public uproar over the proposal this year is. With little fanfare or attention, municipalities in Massachusetts and Connecticut asked people to limit outdoor activities during outbreaks of Eastern equine encephalitis, or EEE, in 2005, 2012, and 2019. But some Oxford, Massachusetts residents weren't happy last week when authorities there declared a voluntary curfew and asked them to wrap up outdoor activities by 6 p.m. through the end of September and 5 p.m. in October, until the first severe frost. The measure was discussed at a town hall meeting attended by about 200 people. According to Philip Davis, president of Oxford's Little League, there wasn't the same level of opposition to comparable steps taken to stop the spread of EE in 2019. When COVID ended, my family and I were done. We were sick of being afraid and cooped up indoors. It's not a good way to live to be afraid, he remarked. However, he noted that the 2019 EE curfews were recently remembered, and that COVID restrictions soon followed. I think everybody at this point in time was just, enough is enough, he said. Let's return decision-making authority to the parents. A virus that infects mosquitoes and transmits to people is the cause of Eastern equine encephalitis. The virus frequently enters the brain and swells or inflames there. Abrupt headache, fever, chills, and vomiting are among of the initial symptoms that may develop into disorientation, seizures, and coma. Rare are the severe cases. The U.S. Centers for Disease Control and Prevention report that approximately 11 human illnesses occur in the U.S. annually. At dusk and dawn, mosquitoes that transmit EE are most active. The municipal and state health officials probably didn't take the dusk to dawn curfew decision lightly, according to Dr. Christy Murray, an Emory University expert on illnesses spread by mosquitoes. In 1938, Massachusetts experienced the most horrifying EE outbreak in U.S. history, resulting in 25 fatalities, the majority of which were children. If the results are alarming, I think public health officials would want to take all necessary precautions to avoid another outbreak, Murray emailed CNN. A curfew serves three purposes, according to Lori Freeman, Chief Executive Officer of NACTHO, the National Association of County and City Health Officials. First, it keeps people off the street when they are most likely to be bitten. Second, it draws attention to the threat and alerts people to it in the first place. And third, in certain situations, it makes people safer when emergency personnel need to spray chemical insecticides that kill adult mosquitoes to control the bug population. As a result of a person and a horse in the area testing positive for the infection, which kills roughly 1 in 3 cases and leaves about 50% of survivors with long-lasting neurologic problems, Oxford and 3 other towns, Douglas, Sutton, and Webster, were placed at critical risk of EE on August 16. The sickness does not have a particular therapy. The Oxford town manager, Jennifer Callahan, informed the town's health board in writing that the individual who tested positive was an Oxford resident. She reported that the deceased's relatives had contacted her and asked municipal officials to issue a warning to others. But some parents and coaches weren't persuaded by that. More than 880 people have signed a Change.org petition against the proposal as of Monday. COVID has already taken away so much of my children's childhood. Over the years, cheering and playing football had given them a sense of normalcy. One user who identified as an ER nurse said, "Please don't shut down the fields. I understand the risk of EE and think it can be managed through other measures like spraying and wearing protective clothing." Another reader stated, "Government overreach in the name of safety has upended our kids' lives enough." Director of Public Health Services at Oxford, Reich Sterrett, is aware of the lasting impact the COVID-19 pandemic limitations had on public health, having a profound effect on both parents and children. She emphasizes that the curfew in the town is optional and only suggested. According to Sterrett, public schools are adhering to the voluntary guidelines. Instead of postponing events or sports, they are rescheduling them or, in cases where it is practical, transferring practices indoors. For outside organizations who wish to use city land going forward, the town has even carved out an exemption. After hours, individuals can still play on city grounds as long as they sign a legal form acknowledging the hazards and present identification of sufficient insurance. So it's just rearranging those practice schedules, and you don't have those evening games under the lights, she explained.